now that the European Society of Cardiology is over and people have had a chance to digest the data to an extent, I think it's worthwhile to do a quick recap of what exactly went on there that might be really quite practice-changing. The first trial to mention would be the RELY trial that examined dabigatran versus warfarin and found that a higher dose of dabigatran was actually superior to warfarin in atrial fibrillation patients, and a lower dose of dabigatran was safer with similar efficacy to warfarin. So it looks like we will probably have some useful alternatives to warfarin in atrial fibrillation. The Plato trial examined ticagrelor, a novel reversible ADP receptor antagonist, versus clopidogrel in a broad range of patients with acute coronary syndromes and found a reduction in ischemic events with ticagrelor versus clopidogrel. Interestingly, this reduction in ischemic events included a reduction in cardiovascular mortality as well as all-cause mortality, so really important finding in the ACS world. Finally, a trial worth mentioning and highlighting is the current Oasis 7 trial that examined ACS patients that received higher doses of clopidogrel, a 600 milligram loading dose followed by 150 milligrams a day for a week, versus standard dose clopidogrel, the 300 load and 75 a day. And that trial had a couple of different parts to it, one part that also looked at different aspirin dosing. As far as the aspirin dosing, no clear benefit or detriment to higher versus low dose aspirin. As far as the clopidogrel dosing, overall it looked like the PCI patients did derive significant benefit from higher dose clopidogrel, but in the weeks and months to come, I'm sure we'll hear a lot more about these three trials as they get teased and dissected out further. Regardless of how that ultimately plays out, clearly these are three important trials that are likely to affect clinical practice.